Hi everyone and welcome back to our channel. We are posting this video a little bit after our normal Wednesday just because of the snowstorm that we incurred here. But as promised, today we are going to talk about medications that could possibly make you gain weight. So the first question you might ask yourselves is why? Why are this medication that I'm on, why could it be making me gain weight? And one of the reasons could be that it's causing an increased appetite for you. So you might find that when you start a new medication, you find yourself hungrier, or you feel like you're craving different things, or you feel like at nighttime you're drawn to the fridge. Some side effects of medications can cause you to have an increased appetite. So if you're eating more and you're not changing anything else in your lifestyle, that can cause an increase in your weight.
You could also be experiencing weight gain because of fluid retention. If you're experiencing that you're swelling, your ankles are swelling, or your wrists are swelling, it could be a side effect of your medication that you're taking, but it also could be the reason why you're experiencing that weight gain or a different number on the scale every time you weigh yourself.
Another reason is because of elevated fat storage. So some medications can cause you to store fat easier. It just has to do with the breakdown in the process in terms of the glycolysis versus glyconeogenesis. So more sciencey stuff, but basically the meds can cause you to store fat easier, and thus if you're holding on to that fat, you're gonna end up seeing an increase in weight on the scale.
Your medication could also be causing your metabolism to be slower than what it typically would be. So metabolism is what really happens when your body is breaking down all the calories and all the food that you ate. It typically occurs throughout the night. So if you're taking a certain medication that could be keeping you up at night or any reason behind it, it may be affecting your metabolism.
Another reason is because the medication might be causing you increased fatigue or weakness. Last week we talked about sleep meds, and medications that make you sleepier to be able to fall asleep at night could, if you don't get enough sleep at night, when you wake up during the day, you could be drowsier. You might not feel like doing as much, and if you don't feel like doing as much, then your body's going to be just only burning calories at its basal baseline metabolic rate. So if you're not doing anything to increase your calorie burn, and you're still eating the exact same way or making not as healthy of food choices, then you could find yourself storing more fat, especially if you're eating more calories. So if your medication, if you are taking anything for sleep, especially just making sure that you get enough sleep like we talked about last week. And just if you do notice that you're fatigued from your medication, maybe talking about your doctor about changing the dose to help with that fatigue.
So we just went over ways that and reasonings that your medication can be causing you to have weight gain. However, you may not catch it right away until you already gained 5 pounds or whatever the amount of weight that you gained. So you can ask yourself, as soon as you start taking a medication, you could notice that you're eating more. So if you're eating more, that means you probably have an increase of appetite and you're just adding more calories to your day, which could cause a weight gain into the future. So be mindful of how much you're eating throughout the day and pay attention to your body, as in asking yourself different questions throughout the day as to why you are gaining weight.
Another thing that you might notice as a symptom, we talked about the fatigue. So if you suddenly feel like you're unmotivated, your energy level's down, you normally can do X, Y, and Z throughout the day, and now you can only get through X. It might be something that you want to say like, hey, this is kind of a red flag. I just don't feel like I'm able to function as well as I have in the past when I wasn't on this med in terms of productivity. So going to talk to your doctor and ask them, is this normally a side effect of this medication? Is there anything that we can do to help lessen this side effect or prevent it? And just looking at that so that you can catch it while you're ahead and get back into the same routines that you had in the past.
And if you are going to the doctor regularly and you think that you may need to be on a different medication, maybe one to help with your mood or stress related reasons, stressors in your life can cause extra weight gain only because it could be causing you to overeat. So be mindful if you are asking your doctor for med to help with that, but the med that they put you on could affect that. So just be mindful of the different stressors in your life and try to find a happy medium between overeating and dealing with your daily stress.
So with all of that being said, problems that can occur due to being overweight, having increased weight, especially sometimes putting on weight very fast, include prediabetes, type 2 diabetes, osteoarthritis, hypertension, high cholesterol, especially the bad cholesterol, the LDLs, or triglycerides, and also metabolic syndrome, which is a combination of having a high BMI, having hypertension, possibly having a high A1C that could make you diabetic. So it's kind of a disease that is a number of different things incorporated in it.
And you're also at a higher risk for having heart disease or even a stroke. You have a higher risk of cancer. You may develop sleep apnea, fatty liver disease, kidney disease, and if you become pregnant or are pregnant, there could become pregnancy problems or complications.
Now we're going to talk about some of the more common medications or classes of medications that can cause weight gain. Just as a preface to this entire list, if you are on any of these medications and they are helping you control a medical condition, don't stop them abruptly. If you are interested in changing medications that your doctor prescribes you, please go to your doctor, follow up with them, ask questions. If a medication is working well for you, even if it's causing you weight gain, it's important that you're taken off of it correctly, or if it's helping you, that you kind of work around it, because it's important to control other medical conditions and not just the weight aspect of medical conditions. So to start, one of the categories of medications that can cause you to gain weight are antidepressants. This is due to it interfering with the neurotransmitter serotonin in your brain that helps to control appetite. So a lot of times it can cause people to eat more. If you're on an antidepressant and it's helpful for you, it's important that you stay on it. It's not to say that just because you're on it, your weight can't be controlled, because it still can be. But if you want to talk to your doctor about the fact that you think that your medication could be causing you to gain weight, that's definitely a conversation that you can have.
Another form of medication are antihistamines that could cause weight gain, and this is because they can cause you drowsiness and become more tired. You can talk with your doctor to find a different one to help with that, or you can just be sure to take your medication in the evening if at all possible. That way, when you're tired, you're already going to be asleep, so you don't have to worry about being sleepy throughout the day or getting your physical activity in because you're so tired.
Another medication class that can cause weight gain are antipsychotics. Again, similar to antidepressants, because it causes you to have an increase in your appetite. These are very essential meds for a lot of people when they are on them. So making sure, again, that you continue these medications and speak to your doctor if you think they're causing you any weight gain.
Beta blockers are another form of medication that can cause weight gain, only because it has the potential to cause fatigue. So the lack of energy will also result in a lack of activity. So that's something to look out for as well.
Another medication class that can cause weight gain are birth control. So specifically, the main form of birth control that can cause significant weight gain is the Depo-Provera injection. Other birth control pills or IUDs can cause slight weight gain, but Depo has been shown to cause the most significant in patients just because of the higher dose of estrogen, progesterone. So the higher doses of those can cause you to have an increased risk of weight gain.
Corticosteroids, they can cause weight gain because they affect your metabolic rate, which can lead to an increase of appetite and overeating.
Some meds that are used in the treatment of diabetes can also cause weight gain. Insulin is kind of the main one. For type 1 diabetics, you know, insulin is really important because they don't produce it themselves. So if you are a type 1 diabetic and you are on insulin, please continue taking your insulin. Type 2 diabetics, because it's not that, you know, you're born with an inability to produce insulin, it's a lot of other factors. There are other diabetes medications that you can get put on prior to having to start insulin, where they can actually regulate things and also could help you lose weight. So, you know, if you are on insulin and you're a type 2 diabetic, sitting down with your doctor and discussing if there could be other medication options that would cause you to help you lose weight versus gain weight, like the insulin can be.
And any mood stabilizer medications have the potential for significant weight gain. So be mindful and ask your doctor if they go to put you on a mood stabilizer, if it has the potential for weight gain.
Thank you guys for tuning in this week. If you are continuing to watch our videos, be sure to like and subscribe to our channel.
And next week is the Wednesday before Valentine's Day, so we're going to talk all about chocolate.
So tune in next week to learn some things about chocolate.